Hello, I'm Dr. Sante Bologna, co-founder of Gastroenterology or Center for Digestive Health. I became a doctor primarily because of the influence of my mother, who was a surgical tech, my uncle, who's a surgeon, but I realized that I wanted to have more continuity of care, so I chose something besides the surgical field. But medicine has always been something I was attracted to. I had strong background in the sciences, got into med school, and then I became a doctor. Gastroenterology, I couldn't spell at the time, but I found that to be very attractive to me. It had different organs. At one time I wanted to be a cardiologist. That's just one organ. I found that not as challenging for me. I wanted to deal with the liver, the stomach, colon, and endocrine organs like the pancreas. So I found it very challenging and satisfying because you have a long continuity of care with these patients. But we also save people from dying from colon cancer screening. One of the more gratifying things that we do as a procedure is we often have a complaint of trouble swallowing, and they put up with this for years, and we come in for 5-10 minutes in an upper endoscopy and we fix their problem and they can eat normally again, where they would have a potentially a life-threatening emergency with a food impaction, where they have chest pain and aspirate food sometimes. So there's a lot of gastroenterology that we do daily that is very satisfying. The biggest tool in my box that I have, by the way, is my ears. If I listen to the patients, they tell me a lot more. And for the last quarter century, I've been seeing patients in my office across from my desk, where I have an exam table in my office, and they tend to tell me a lot more than they would have behind a computer screen. And although I built this, when I started this 27 years ago, we built this as a practice of 10 doctors now, 150 staff or more. We started with 3 staff and a small office of 600 square feet. But although I like to build things, at the end of the day, I like to take care of patients. And I'd sure like to take care of you, and any of my partners would like to do that as well.